It's pretty well known to doctors that the most successful treatment for obesity is surgery, and specifically the gastric bypass operation. But here's something the medical world is just realizing, that the gastric bypass operation has other, even more dramatic effects. It can force type 2 diabetes into almost instant remission, and it appears to reduce the risk of cancer. Surgeons have been performing bariatric or weight loss operations since the 1950s, but they're much safer than they used to be. They're typically done laparoscopically now, so doctors use tiny surgical tools and video cameras instead of making big, deep incisions. Despite the increase in obesity, only a small number of people have had the gastric bypass operation, and we met some of them, people who were once morbidly obese. Here's Tony Seidman before gastric bypass surgery.
My surgery was April 23rd, 2007, and I've lost 140 pounds.
Here's Janet Roback before.
I'm 8 months out, and I've lost 91 pounds.
And here's Travis Goodboe.
It's been about 7 months, and I've lost about 260 pounds.
Wow. Dr. Neil Hutcher from Richmond, Virginia, has performed more than 3,000 bypass surgeries.
How many people gain the weight back?
You know, I think when you're dealing with a incurable disease that kills many people, if you have an 85 to 90% success rate, that's pretty darn good.
Is that what you have?
Yeah, yeah.
There's no diet, no exercise regimen, no pill with a success rate like that. These patients lose a ton of weight and keep it off. Here's how Dr. Hutcher does the surgery. First, he sections off a small pouch of the upper part of the stomach. Then he attaches it to the lower part of the small intestine, bypassing most of the stomach so that there's not a lot of room for food.
I want to ask you a question about the safety of this operation,
Okay.
the danger of the operation, because there have been deaths.
It used to be that roughly 1 in 100 people died from this operation. Hutcher says it's now about 1 in 1,000, which makes it less deadly than most major surgeries.
It's less than gallbladder surgery. It's less than, it's about 1/10 of cardiac surgery.
It's safer because of new surgical techniques, which have also made it more effective. For instance, they can make the stomach pouch smaller than they used to.
Even if I wanted to eat a whole cheesecake, my stomach is very tiny. It holds 4 ounces max, stretched to the max. And that's not even one piece of cheesecake.
A big reason the operation works is because it seems to suppress appetite.
If you listen to your patients, they come back and they say, "Doctor, you put the fire out."
When you see a sign for fast food, or she's already shaking her head at me.
I don't want it. I used to crave sweets all the time. I couldn't go past the gift shop at work without getting a candy bar. Now I go past it and I never give it a thought.
Paul Delios of Saugus, Massachusetts, has lost 90 pounds.
Paul, we have to tell everybody what you do.
I own a donut shop with my siblings.
Can you believe this? The smell of those donuts every day, right?
Yeah. Before I'd have cravings for everything. Now I really don't.
For most patients, the cravings really do disappear. One theory is the operation suppresses the levels of a stomach hormone called ghrelin that activates the sensation of hunger. Yet most people who have this operation do not get skinny. Dr. David Cummings, an expert on appetite at the University of Washington, says as a rule, these patients end up just 1/3 lighter.
So if you weigh 300 pounds,
You go to
you'll
200.
end up still weighing 200 pounds.
Most people with severe obesity who undergo gastric bypass do not become fully normal in terms of body weight. They go from severely obese to mildly obese, or from obese to overweight. But nevertheless, it's an enormous change.
And not just in terms of weight loss.
How long have you had the diabetes?
Dr. Hutcher says the operation itself can take type 2 diabetes, which has ballooned in this country, and throw it into complete remission. How many of you had diabetes before your operation? All of you. How many of you have diabetes now? None of you. All right, that means they no longer need sugar control medication like insulin injections. So, Vicki, you went from how many needles a day?
8 or 9.
8 or 9 shots every day.
To none.
And you're diabetes-free.
Done.
Cured?
Cured.
Would you use the term cure diabetes?
I think my patients are cured.
Cured? I mean,
Well,
no
they
insulin?
go home on no medication, and I followed them now for 10 and 15 years and see no evidence of recurrence. So it's pretty darn close.
Studies confirm that about 80% of diabetics go into complete remission following the operation. Obesity is considered one of the major causes of type 2 diabetes. But here's something odd. When you have the gastric bypass operation, your diabetes goes away long before you lose the weight. Tell us how long it took you to get rid of diabetes and go off all your medication. Travis?
About a week and a half.
Bill?
4 days. I went in the hospital on Friday, came home on Monday, and dumped my pills.
I haven't been on medicine since I came home from the hospital.
This spontaneous remission puzzled Italian surgeon Francesco Rubino, now at New York Presbyterian Hospital.
And we wanted to know what is making diabetes remit. So we thought it could have been something that has to do with the small bowel.
So he began performing the bypass on diabetic rats and realized that when he disconnected the top of the small intestine, an area called the duodenum, the diabetes disappeared. Then he reversed the operation. When you reattached it, it came back. Is that right?
That's right.
This was a pivotal discovery. By merely blocking food from traveling through the duodenum, Rubino sent diabetes into remission, proving the effect was independent from weight loss. This meant diabetes could essentially be removed with a scalpel.
Now, have you done this operation on humans?
Yes.
We joined him in Sao Paulo, Brazil, where clinical trials have begun on diabetics who are not obese to determine if the diabetes surgery is safe and effective.
So now the small bowel is divided?
As of now, if you have diabetes and are not obese, you can't have the bypass surgery. Under guidelines written by the National Institutes of Health 17 years ago in 1991, only the severely or morbidly obese are eligible for any bariatric operation. If you're just mildly obese, you can't get it.
A lot's changed since 1991. I would like to see them change their guidelines, especially for the diabetics. I think we have clear-cut evidence that we can do terrific things for diabetes.
The NIH told us there's no plan to revise the guidelines, but they are currently examining the benefits and risks of bypass surgery. For instance,
I've seen some studies that say that suicide rates go up among patients who have this operation. Now, why would that be?
We're not sure. A lot of our patients are very depressed. When you lose weight, there's a period of euphoria, and then there's a period of realization that maybe my depression wasn't related to pounds.
But meantime, the positive side effects continue to accumulate, like
sleep apnea. Sleep apnea is one of the silent killers. That's where at night you literally suffocate. You stop breathing.
How many of you had sleep apnea? Wow. Okay, how many of you have sleep apnea now? None of you? It just went away?
That's because of the weight loss. Dr. Bruce Miller, a family doctor from Hopewell, Virginia, has lost 120 pounds in 3 months.
I've seen all my other problems improve as well. I don't take any blood pressure pills anymore. I don't take any cholesterol pills anymore, as well as my diabetic medicine. I'm off all medicine.
In addition to the operation reducing hypertension and coronary artery disease, there appears to be an effect on cancer as well.
Does being fat give you cancer?
Being overweight or obese increases the likelihood that you'll get several different types of cancer.
Dr. Eugenia Cal, an epidemiologist at the American Cancer Society, has been studying the link between cancer and obesity.
And what kinds of cancer?
Breast cancer, colon cancer, endometrial cancer, kidney cancer, cancer of the esophagus, pancreatic cancer, liver cancer.
I should have said what cancers aren't affected by obesity.
There are very few that aren't affected, yes.
So have you been able to calculate how many people die every year of obesity-related cancers?
We have, and our estimate is that about 100,000 individuals in the U.S. every year die of cancer because of their weight.
So if you lose weight, you're fending off cancer.
Well, that is and has been up until now sort of the piece of evidence that hasn't been in place. People don't really lose weight in this country.
They lose it and gain it right back.
They lose it, they gain it back.
But now researchers are studying people who've had bypass surgery because they tend to keep the weight off.
And in those populations, very interestingly, the overall cancer risk is greatly reduced, cut in half.
Cut in half?
Cut in half, yes.
The number of people having weight loss operations grows every year, but it's still a small number compared to the millions who are eligible for the surgery and the many more who could benefit.
So what percent of the people who are eligible for this operation, actually eligible, get it?
Actually, less than 1%.
And how many had the operation this year?
About 200,000, so it's 1%.
The bypass operation costs an average of $25,000, and insurance companies don't always cover it. And despite the gains in safety, most doctors still consider the operation an option of last resort. That is no longer the case for Dr. Miller's patients.
I look at them now, and I'm handing out my surgeon's card right when I see them. I'm not waiting for the last resort now.
Do you think most doctors are where you are?
Probably not. They haven't walked the walk.
Say if you're used to a lifestyle of eating, eating makes you comfortable. You're sad, you're mad, whatever the case may be, you eat.
Travis Goodboo is just 26 years old. Heavy his whole life, he got the operation in July to change his weight. It ended up changing his health and the way he lives his life.
For me, I think I was addicted to food.
Yeah.
I love to eat, I love to cook, I love everything about food. Now, I love moving. I'm kind of addicted to life.